So the reason that it might be valuable for patients to get the lower doses, first of all, in the patient who comes to me, sometimes they've found it starts to be really intrusive for their lives if they have to time vacations around when they get to pick up prescriptions or things like that, or they've had an opportunity to go away, but their pickup day is 2 days away and they can't get in touch with our clinic to release. So the patient may just want a little bit more freedom, and they may want to try and see if they can do at a lower dose or without the medication, because that would free their lives up. So that's one thing. The other reason, so if there's an immediate side effect like sleep apnea, for example, which could be quite dangerous, or falling asleep through the day, which is really not high quality of life, then I will say to them, look, let's just come down a little bit on the dose, and let's see how you do with that, see how these other side effects play out. And so that may be the reason for tapering. Or the other reason, when people are simply on a high dose, even if they seem to be functioning well, one of the things that we see from the large population studies, especially ones done by Tara Gomes, for example, at the ICES, the Institute for Clinical Evaluative Studies, using their Ontario healthcare data, they've seen that as doses increase, we do see a gradual but a noticeable increase in really serious side effects like accidental overdose or even death associated with increasing doses, particularly when you get past that 90 milligram morphine equivalent per day. So in that case, it may be worth trying to get the dose lower in the hope that we would move that patient into a lower risk group for these relatively uncommon but really serious side effects associated with higher doses. So that's the kind of conversation I will have with the patient, that we may be able to improve your quality of life, and we would try to do it without adversely affecting your pain control or your ability to function. Or in the case of the high dose patient, we may be able to move you into a lower risk group, or at least keep you functioning at the same level but still at a lower dose of medication. So that's really where we're going with those discussions.